This morning, I am pleased to announce the launch of the Youth Mental Health Training Program led by the Department of Health. This important initiative is designed to empower local professionals who serve the youth of Bermuda with the essential skills to recognize, respond to, and refer young people experiencing mental health concerns. The program is particularly valuable for those who want to increase their confidence and competence in supporting young people during critical moments. This initiative is part of the Ministry of Health's ongoing commitment to build community mental health capacity, create sustainable support systems, and strengthen the safety nets around our youth. Mr. Speaker, adolescence is a highly impressionable period characterized by emotional, social, and neurological changes that can be challenging for a young person to navigate. When we recognize challenges early and come together to support our young people, we give them the tools to cope in healthy ways and help guide them towards a positive future. By equipping teachers, school staff, youth workers, coaches, mentors, social service providers, healthcare professionals, community volunteers, and others who regularly interact with adolescents, we reduce stigma, improve early intervention, and build compassionate, more resilient communities. Mr. Speaker, the Youth Mental Health Program is a 3-day course delivered via 2 days of interactive workshops offered virtually or in person for skills-based learning and 1 half-day in-person sessions that takes a deep dive into adolescent brain development, anti-stigma strategies, and local referral processes and pathways. Additionally, monthly training sessions are scheduled throughout the year, and lunch will be provided for in-person participants. Mr. Speaker, the Youth Mental Health Training Program blends foundational knowledge with practical skills for mental health support. Participants can expect to build core skills in the following, Mr. Speaker: identifying early warning signs of mental health concerns in adolescents and understanding how to observe changes in behavior, mood, and functioning. Providing safe, immediate support that is youth-friendly, non-judgmental, and appropriate to the situation. Understanding referral pathways and knowing when and how to connect a young person with professional services. Using anti-stigma strategies and youth-centered communication to create environments where young people feel safe to seek help, and maintaining personal well-being while supporting others, including practical approaches to avoid burnout and secondary trauma. Mr. Speaker, this training also covers knowledge content on adolescent brain development, available resources on island, and collective brainstorming for stigma reduction within organizations. Participants who successfully complete the evaluation of the training will receive a certificate demonstrating their competency and mastering of these skills and concepts. Mr. Speaker, the Youth Mental Health Training Program recognizes that young people are best supported by the people they trust most, such as their family members, teachers, coaches, mentors, and community volunteers. Strengthening the skills of these trusted adults builds the community safely and a safety net that provides wraparound support. As we build capacity, we also build linkages between community support and professional services. This means supporting adolescent mental health is not just the role of clinicians, but a communal shared responsibility. Creating overlapping layers of support not only reduces delay in mental health support, but also ensures that no young person falls through the cracks. Mr. Speaker, as more people in our community develop competencies in adolescent mental health support, we will continue to break down stigmas, thus making it easier for young people to ask for help. In the short term, we are building a Bermuda where the youth receive the timely, compassionate, and appropriate support they need at the appropriate level. In the long term, Mr. Speaker, such training initiatives not only contribute to a more resilient youth population, but also drive cultural changes in how we think about and respond to adolescent mental health concerns and influence positive outcomes for young people across families, schools, sports clubs, and community programs. Mr. Speaker, in closing, the Youth Mental Health Training Program reflects the government's commitment to strengthening Bermuda's mental health landscape and ensuring the young people receive informed, compassionate support when they need it most. By investing in the adults who surround our youth, we invest in stronger families, safer schools, and healthier communities. I encourage anyone who works with adolescents to register and join us in building a more resilient future for Bermuda's young people. Registration is open, and further details on the schedule of sessions are available at www.gov.bm/youth mental health training. Thank you, Mr. Speaker.